The Radiation Oncology Center for Innovation is really about possibilities. It's really about making the impossible possible.
Unfortunately, in healthcare, for too long, we thought we had all the answers. And despite how smart we may be, the truth is we've spent too little time listening to our patients.
One of our patients who coded during chemotherapy, and we had to resuscitate them. And I was speaking with this patient and his wife. I said, tell me what was the most challenging or the hardest part of this whole process for you? And they instantly lit up with vigor and said, it was the 2 weeks in which we waited to start our care. And I couldn't believe that they said that, given that basically this man had died in front of this woman, and that wasn't even on their radar. It was the 2 weeks that they were suffering while they waited to take action against their cancer. And that was really personal to me, and it made me want to make this change.
If you think about oncology, it's really all about, I want to make a difference in people's lives. I want to look at things differently. I want to stop doing the status quo. I want to challenge myself. And I want to do something that nobody thought that we could ever do and have that dramatic impact on that patient's life.
I mean, the ideas that are coming out of this group are now going to be put together as a separate unit to actually sit around and think about innovative things, which may translate into other programs adopting some of the things we're coming up with, which I think is extremely exciting.
The Radiation Oncology Center for Innovation is comprised of people in our department, also people that are scientists, also computer programmers, people that can make things happen. It's a really exciting group to be a part of because we're building an entirely new future here.
We have the kind of team here that believes in each other enough, and we believe in ourselves enough, probably ridiculous amounts of belief in ourselves, to allow us to keep going and push through that and get to the point where we can see real change, real innovation.
The level of innovation here and change is very stimulating, and it's all towards better care for patients. The day-to-day operational improvements that I've seen with automation have really revolutionized radiation oncology.
I think the work that radiation oncology has done, which has produced results in terms of clinical quality, service, cost effectiveness, helped our bottom line financially. It's such a powerful microcosm, and I think it can serve as an example to the rest of the organization of what's possible when you truly take the lid off and free people up to bring their best and support them in doing that.
Our moonshot is delivering care at the speed of the patient. And what that means is that people should be able to have the care that they need exactly when they need it and when they're ready for it.
Our brand promise, being right here with you, is intimately connected with what this team is doing. We're starting with the human need and then adapting our expertise to meet that need. So once you know that patients are laying on the table naked and there are 4 other people in the room staring at them, now we have to ask the question of what do we want for that person? As a human to human, what do I want for them? Well, I don't want them to be humiliated. I want them to have dignity, right? And so that's a great example of something that this team is working on.
It's the biggest thrill to figure out something and that you thought this might not work, this shouldn't work, and to deliver on that and really change the paradigm.
The willingness to entertain a new direction to go in, even some of the crazier ideas sometimes will pan out or maybe lead to something else. So I think that's been exciting.
I feel that if there's an idea presented at whatever level, our leadership is here to hear it out and to implement it if it can better the patient experience, because ultimately we're here for the patients.
To be able to say, this is really efficient, and it truly is, and it truly saves my time, that's huge.
I think this is the future of radiation oncology. I'm very excited to be part of it, sort of at the ground level. Can't wait to see what we're going to be up to next.
In the future, I hope that the work of the Center for Innovation produces something that patients can look at it and say, this is exactly what I expected. This is exactly what I wanted. I was even surprised by how well they anticipated my needs and they took care of me.
The culture and the environment that we've created here can be applied anywhere in the hospital, in any department.
I think oftentimes the constraints that people see or feel in an organization like ours and with a culture like ours are self-imposed. And I want you to know from your CEO that you have 110% of my support to rethink things and to reach farther, move faster, think about new ways to do things.
The possibilities are endless, and it's really all about what you believe about yourself.
To any of you who think you can't be an innovator, I want to say, if you have an idea that you've been itching to try, then that means you can be an innovator. Try your new idea. Talk to your patients. Talk to your patients' families. Learn from them and share your idea with us. That's what innovation's about, and we welcome it. We want to be the team that does better for our patients and their families. We're waiting to hear from you.